Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
The Health Secretary, Matt Hancock, has been defending the timing of the first COVID lockdown in England last year. Speaking to a Commons committee looking at what lessons can be learned, he insisted ministers were following expert advice. He said that at the time, he was being told there could be as many as 820,000 deaths. It was also Mr Hancock's chance to formally rebut claims made by the former number 10 advisor Dominic Cummings that he'd lied to the Prime Minister. Our deputy political editor, Vicky Young, is at Westminster for us now.
Well, George, plenty of things have gone wrong over the last 18 months. What MPs are trying to do is to make sure those mistakes aren't repeated. They'll also look at what went well, the vaccine rollout, for example. Why was that so successful? Matt Hancock, of course, has been at the heart of the decision-making throughout this pandemic. Today, he gave a robust defence of the government's response, pointing out that it was an unprecedented situation which many countries have struggled to deal with. He also said that he was delighted to get a chance to give his side of the story. What more should the government have done to prepare for an emergency like this? When the COVID pandemic hit, crucial decisions had to be taken fast. MPs are trying to find out how that could have been done better. Matt Hancock recalled that early last year he'd told officials to prepare for a reasonable worst-case scenario.
That was a planning assumption for 820,000 deaths. And I was determined that that would not happen on my watch.
So why wait so long before ordering a lockdown? Mr Hancock pointed out that there were very few confirmed cases, and the advice was that the public wouldn't tolerate restrictions for more than a few weeks.
I remember the moment around the cabinet table when I said, we are going to have to tell everybody to stop all social contact. Right. And I remember thinking, this is the most extraordinary thing that I've ever said. And the Prime Minister said, yes, we are. You better go and tell them.
Matt Hancock says the UK responded well in areas where it was already strong. So the NHS massively increased the number of beds. There was existing scientific expertise, but there was no testing capacity. There wasn't enough protective equipment. And ministers, he said, were making decisions based on incomplete or wrong information. One crucial misunderstanding was that the virus could only be spread by those with symptoms. Mr Hancock remembers seeing some evidence that this wasn't the case.
I bitterly regret that I didn't overrule that scientific advice at the start and say we should proceed on the basis that there is asymptomatic transmission until we know that there isn't, rather than the other way around.
And what about one of the most serious accusations?
Why did you not heed the warnings about dangers to the care sector?
Mr Hancock admitted there hadn't been enough capacity to test patients leaving hospital and returning to care homes. But
the evidence has shown that the strongest route of the virus into care homes, unfortunately, is community transmission. And so it was staff testing that was the most important thing for keeping people safe.
When Dominic Cummings, the Prime Minister's former top advisor, gave his evidence 2 weeks ago, he accused the Health Secretary of lying and said he should have been sacked for his handling of the pandemic.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
Thank you.
The best thing to say is that government has operated better over the past 6 months.
Which just happens to be when Mr Cummings left Downing Street. Vicky Young, BBC News, Westminster.
So, as we heard, one of the most contentious issues in this pandemic has been how the care of elderly and vulnerable people has been handled, including those living in care homes. Today, the Health Secretary defended his decision-making around the early discharge of residents from hospitals into England's care homes. But, as our social affairs correspondent Alison Holt explains, there are still unanswered questions about the decisions made at the time.
From care home to care home, families and staff want to understand why so many residents died at the start of the pandemic. Today, Matt Hancock insisted they weren't an afterthought. It felt different at the time.
It's been so awful. I mean, it's awful. It's just surreal.
Staff struggling to get testing and protective equipment.
I would appeal to the government. The guidance needs to change if they want us to look after these residents to the end.
and the sense of abandonment.
It's really not good enough. We need to be heard and we need to be saved.
Dr. Kathy Gardner watched Matt Hancock's evidence today and believes he sidestepped most issues. She's taking legal action against the government over the death of her father, Michael Gibson. He died of COVID soon after a hospital patient transferred to his care home with the virus.
There's absolutely an attempt to rewrite history. A lot of what the government has given us more recently just looks like the benefit of hindsight. What matters here is the truth. What matters is the evidence. Who said what and when? Not what they're now saying about what they really meant. We're looking for the facts.
For instance, families want to know the risk assessment behind the NHS letter sent out on March the 17th last year, a week before lockdown. It led to the urgent discharge of medically fit hospital patients. Some transferred to care homes, most weren't tested. That only changed on April the 15th. By then, 25,000 hospital patients had been moved to care homes. Matt Hancock insists few outbreaks were caused by this. He also says the important word in this statement a month later was try.
Right from the start, we've tried to throw a protective ring around our care homes.
Here at Pelham House in Folkestone, they lost 10 people, half their residents, to the virus. The home's owner describes what he's hearing now as demoralising.
It makes you feel dejected and to some degree in despair. There was such a lack of coordination and focus on what really mattered, and what really mattered was the care of vulnerable people.
It wasn't just England that struggled to protect residents at the start of the pandemic. Scotland, Wales and Northern Ireland also saw significant increases in care home deaths.
You got some more tea?
It means across the UK there are challenging questions still to be answered. Alison Holt, BBC News.
Now, the Health Secretary, Matt Hancock, defended himself today over his handling of the COVID crisis. Questioned by a committee of MPs about allegations made by Dominic Cummings last month, Mr Hancock denied that he had lied to the Prime Minister. Our political correspondent Romilly Weeks watched the session.
For a man fighting allegations of incompetence and dishonesty, Matt Hancock was doing his best to look cheerful. Today it was the Health Secretary's version of events.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
After what we'd heard from him.
The Secretary of State for Health should have been fired for at least 15, 20 things, including lying to everybody in multiple occasions.
Dominic Cummings had promised evidence to back all that up. But right at the start of today's hearing, the committee made this clear.
We have not received that evidence, nor any explanation as to why that has not been available.
Today's first round to the Health Secretary, perhaps, but on testing, on PPE, and crucially the release of people into care homes from hospital without testing. Mr Hancock was still under pressure.
You said, Secretary of State, right from the start, we've tried to throw a protective ring around our care homes. What was that protective ring?
Well, I think the most important words in that sentence are that we tried to. Mm-hmm. It was very hard. And all of these deaths in care homes, each and every death in a care home weighs heavily on me, and always will.
Listening to those words, Nicola Richards, who lost 27 residents of her care homes to COVID.
I think he's failed us. He's failed residents, he's failed families, he's failed staff. It's just, I watch that and I get so angry. I also get really upset thinking what we've all been through.
The Health Secretary's nemesis wasn't watching the case for the defence.
I'm dealing with TV repair man. I'm afraid.
Perhaps he'd been throwing things at the television. For his part, Matt Hancock was quite restrained, but he did add this.
The best thing to say is that government has operated better over the past 6 months.
6 months ago was when Dominic Cummings left government. Romilly Weeks, ITV News.
The government's decision-making in the early days of the pandemic will forever be scrutinised. Today, we got a bit closer to finding out what the Health Secretary says he did and did not know early last year. For 4 hours, Matt Hancock answered questions from MPs defending his role in the COVID response in England. Our Health and Social Care editor, Victoria MacDonald, has this report.
The Secretary of State for Health should have been fired for at least 15, 20 things, including lying to everybody.
Did you know that he wanted the Prime Minister to fire you?
Yes, because he briefed the newspapers at the time.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
This was not meant to be Dominic Cummings versus Matt Hancock. This was a hearing about lessons learned from the pandemic. But 2 weeks ago, the Prime Minister's former aide gave such damning evidence against the Health Secretary, it did need addressing. Mr. Cummings was less vocal today, but it does turn out he has missed the deadline to provide any evidence to support his allegations. Back in the room, Mr. Hancock's grilling covered care homes.
Did you tell the Prime Minister in March that people in hospitals would be tested before they went back into care homes?
We set out a policy that people would be tested when tests were available. And then I set about building the testing capacity to be able to deliver on that.
At the centre of this is the now well-documented and distressing excessive number of deaths in care homes. Mr. Hancock claimed today that the best estimate was that only 1.6% of transmission was because of discharge from hospital. This was disputed by the committee co-chair.
The whole point that we've been discussing is that testing was not available in care homes. So isn't it, to put it most politely, a stretch of the imagination to believe that 1.2% of cases, 1.6% of outbreaks are attributable to hospital transmission?
Then there were questions over PPE and shortages or not.
Families of the 850 healthcare workers deserve to know why it was that their family members went to work unprotected.
We've looked into this and there's no evidence that I have seen that a shortage of PPE provision led to anybody dying of COVID.
Do you know what the risks were in regards to the procurement of PPE?
Yes, I knew the risk was if we didn't buy enough, people wouldn't have enough PPE. And thankfully, because my team did such an excellent job, we never had a national shortage of PPE.
Which is not how many NHS staff remember it as they scrabbled for protection. And this document from Public Health England also revealed shortages. The Health Secretary added that in fact 1,500 health and care workers have died with COVID. If this is a precursor to the independent inquiry due to start next year, it only highlights the complexities. Asymptomatic transmission. Mr. Hancock said he had asked and had been told there was no evidence of this in January, and that even in April the WHO was sticking to this line.
I bitterly regret that I didn't overrule that scientific advice at the start and say we should proceed on the basis that there is asymptomatic transmission until we know that there isn't, rather than the other way around.
SAGE papers from the 28th of January do, however, say there was limited evidence of asymptomatic transmission. In terms of theatre, it was not as gripping as a fortnight ago with Mr. Cummings, but the Health Secretary was emphatic about what needed to be done in this pandemic.
Throughout this, I have got out of bed every morning with the view and the attitude that my job is to do everything I could to protect lives and to get this country out of the pandemic.
If Mr. Hancock breathed a sigh of relief after today's session, it will have been short-lived. This afternoon, Mr. Cummings said in his blog that he will publish the evidence.
He didn't lie to the Prime Minister and showed honesty and integrity throughout. His version of the management of the pandemic told to MPs by the Health Secretary. Matt Hancock said that only a tiny proportion of care home cases were seeded by patients released from hospital, something one care home owner told us was insulting. More on that in a moment, but first our Deputy Political Editor Sam Coates reports.
Dominic Cummings today, still wanting people to follow him. 2 weeks ago, he suggested excoriating questions for the latest pandemic lessons learnt session with MPs, all to be bowled at the Health Secretary in another attempt to get him out of a job.
Is it your chance to give the version of events today, Mr. Hancock?
The session turned out to be less explosive, but more important than it had been billed. He began by rattling through denials of the specifics put to the committee 2 weeks ago, of lying, including to Boris Johnson.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
Today mattered because Matt Hancock discussed not whether things went wrong, but why. The Health Secretary appeared to accept the government lockdown later than it might have done, but stressed he personally was across the scale of the challenge as early as January last year.
I was given the planning assumption based on Spanish flu, and it was signed off at Cobra on the 31st of January. And that was a planning assumption for 820,000 deaths. And I was determined that that would not happen on my watch.
MPs in the inquiry today told us what their conclusions are going to be. They think we locked down too late last March, there wasn't enough testing early on, and they're probably going to find that we shouldn't have sent patients from hospitals direct to care homes. What was interesting, though, was Matt Hancock didn't reject those findings. Instead, he tried to give context, background, even shape who people should think got the blame. Questions about care homes came thick and fast. Should testing have happened before patients arrived? Was staff really responsible for most cases? Then there was the concern voiced by care home staff complaining to Sky News that they lacked personal protective equipment, PPE. But today, the Health Secretary said,
despite local challenges, and I don't deny at all there were challenges in individual areas, there was never a national shortage of PPE because of the action that we took.
And yet a report into PPE by the government's own watchdog found many frontline workers in health and adult social care reporting not having access to the PPE they needed during the height of the shortages. Learning lessons to avoid more scenes like this. But key players still very careful to make sure the finger of blame doesn't point at them. Sam Coates, Sky News.
So Matt Hancock said in his evidence that each and every death in a care home weighs heavily on him. The Health Secretary, though, also downplayed the impact of his decisions on the wave of cases that led to tens of thousands of deaths in care. Our People and Politics correspondent Nick Martin spoke to two people directly affected.
I've heard many stories of people reusing masks.
It has been over a year since Lindsay Allison lost her father-in-law, John, to COVID, and she's been wanting answers ever since. John was 76, and his family say he caught the virus in a care home shortly after being discharged from hospital. He died 2 weeks later.
A year ago, roughly to the day, me and you were sat here, Nick, talking about how the Health Secretary said that his main aim was to protect, shield the elderly and the vulnerable. And I think what he meant by that was the NHS, because care homes didn't get protected. As we know, he's still denying it. And it's just not on. We've not had any apology. He refuses to admit any fault whatsoever.
At the beginning of the pandemic, many care homes struggled to prevent the spread of COVID. This was either because PPE supplies were scarce or because thousands of hospital patients were sent to care homes without a test. But Matt Hancock told the committee that untested discharges contributed to just 1.6% of care home deaths, instead claiming staff might have brought the virus in from the community.
Sadly, the biggest route of COVID-19 into care homes is through the community. It's through people who live in the community and work in the care home.
That's angered people like Pearl Jackson, who runs 21 care homes across England and has been in the care business for nearly 40 years. 19 residents in this home died of COVID.
We were out there swimming or paddling on our own, so it's rather offensive to suggest otherwise.
What you've heard the Health Secretary say and how he explains events, how far removed is it from the way you witnessed events?
It's the opposite of what happened. And I can understand he's trying to explain his position. It's a very difficult position as Health Minister during a pandemic, but it's not what happened.
The Health Secretary says the government tried to protect care homes from the very start. But Matt Hancock's account of the government's early handling of the crisis in care homes is now widely disputed by many of those who witnessed it firsthand. Nick Martin, Sky News.